I'm an inquisitive clinician, and I'm always looking for ways to do things a little bit better.
It's interesting, the intersection between clinical care, research, and innovations.
Ophthalmology is very image-based. Because we can see now the detail of the retina at a great level, what we realized was an unmet need in looking at these images in very particular disease states, and then understanding the impact our treatments had on these images and whether we could quantify them or not. Dr. Justis Ehlers and I realized together that if we could develop a set of tools that would actually allow us to look at some of these images. We were both interested in identifying small changes in the operating room when we operate on patients and using a device called intraoperative OCT, or optical coherence tomography. It gave us the ability to see microscopic changes as we operated.
So we really started to innovate in that space, and how could we measure some of these changes we were seeing based on surgical manipulations.
We need to develop an algorithm to automatically do this. We need to turn this algorithm into a validated tool. And once we validate the tool, can we turn it into software?
What our studies have shown is that this technology enables us to have knowledge as surgeons that we wouldn't have otherwise. Over the last 6 to 7 years, it's been taking that technology that we developed for the operating room and then applying it now to clinical disease and biomarker discovery that has really impacted what we're doing within our research program, but also from an innovation side of how we're impacting clinical trial design or even clinical trial endpoints.
It's really exciting for us to see that all the analysis that we've done is now being translated into improving the range of therapeutics that are available to our patients. There's a whole range of diseases that these kind of tools can help us understand. We're really excited about what kind of things we can do in the future.
Knowing when to engage, and especially early on, having that relationship so that your innovations partners can understand the trajectory of the research path that you're on and how to be effective in translating that to the next step. I think that's really probably the most important piece in the early journey.
I tell my colleagues, collaborate, come up with ideas, start small. Just keep working at it, fail a few times, and then go back and look why that was the case and try to make it a little bit better.
As this very forward-thinking clinical care group, we have the opportunities to innovate and potentially move towards those solutions in ways that I think are unique to what the Cleveland Clinic model affords.